causes of chronic kidney disease, and then lifestyle causes of chronic kidney disease. In other words, things that when you and I do can lead to chronic kidney disease based on our lifestyle. So let's start with the medical causes. One of the main causes of chronic kidney disease, which is the leading one, is diabetes. Diabetes, where your blood glucose continuously remains uncontrolled. If you have sustained elevated blood glucose, we say that you have diabetes, either type 1 or type 2. Eventually, it is going to put you at risk of getting chronic kidney disease. Why? Normally, the kidney is here. It's not supposed to filter glucose, but in the diabetic population or people who are living with diabetes, what happens is that because their blood is saturated with glucose, the kidney is not able to help eliminate everything, and by so doing, more glucose is allowed to pass through your kidney, and as the glucose passes through the kidney, it eventually destroys your kidney. And this is why people who are diabetic eventually end up with kidney problems along the way. So that is medical cause number 1. Number 2 medical cause is high blood pressure, hypertension, high blood pressure. People who are living with hypertension, 1 out of 3 of them are going to end up with chronic kidney disease in future. If you are diabetic, 2 out of 3 are going to be having kidney problems in future. So now let's look at why hypertensive people or people who have high blood pressure, they tend to have chronic kidney disease or kidney problems along the way. The pressure entering the kidney is higher than expected, and because of that, the blood vessels that is supposed to carry blood to the kidney are destroyed. So over time, there is less blood flow to the kidney, and because of that, people who are hypertensive or people with high blood pressure, they also tend to have problem with kidney issues in future. So take note of that. The third medical condition that can lead to kidney problems or chronic kidney disease that you need to know about, or we want to talk to you about, is what is known as polycystic kidney. Polycystic kidney. What is polycystic kidney? In some people, they are born, it's a genetic condition, and when they are born, their kidney, okay, it becomes very big, and this kidney contains water inside them. If you are born genetically, and then because of genetic issues, you have a kidney that is big and with water accumulating inside, we call that polycystic kidney. And it has many sacs. And these sacs, each of them contain water. By so doing, it does not allow the kidney to function optimally, and this leads to kidney problems eventually. So that is also another medical cause. The next medical cause that I want to talk about is urinary tract infection. Some people are listening to me. You may end up with kidney problem in future, not because of anything, but simply because when you get a UTI, a urinary tract infection, you don't take time to get it properly treated. If you end up with UTI, as simple as it may be, but you don't pay attention to it, you take antibiotics purely, along the way, you stop taking it, it comes back again, and then you go and buy another antibiotics. Some of us don't even go to the hospital for proper treatment. This UTI, when you don't treat it well, it tends to cause inflammation in your kidneys, and this inflammation can eventually cause problems and decline the kidney function, and this can lead to kidney problems in future. So common UTI, if you don't take care of it, you may end up with chronic kidney disease in future. Take note of that. Another important one is the men. Men who end up with prostate problems, okay, prostate problems. If you get a prostate enlargement, your prostate becomes big. Let me shift this side. So normally, men have prostate gland around this area, okay? Men have a prostate gland around here. If you're a man listening to me and your prostate gland becomes very big, what it does is that it constricts the bladder neck. So when this happens, The urine gets to the bladder here, but you are not able to let everything out. As a result of that, eventually, some of the urine tends to be flowing back into your kidney, or it will be accumulating in your kidney. And this can lead to chronic kidney disease. Very, very important. Those are some of the medical causes of chronic kidney disease. There are a lot of them, but I don't want to bore you. I want us to talk about the lifestyle causes of chronic kidney disease, which is so important to me. Please invite somebody, let them come and learn. This guy we are talking about here today, it takes away 1.3 million people every single year globally. 1.3 million people every single year. And as I speak to you, 800 million people globally are suffering from chronic kidney disease. So this is a very important discussion. God bless you. Let's continue. Now, the question is, what are the things that when you and I do, we eventually be putting ourselves at risk of chronic kidney disease, also known as CKD? Sweetheart, I'm going to be very blunt here. Sorry, guys. I'm going to be very blunt here. Some of us, one of the common lifestyle that is eventually going to make you get kidney disease, chronic kidney disease for that matter in future, is holding onto urine. Holding onto urine. This topic is so important. We are here to open your eyes about certain things that you underestimate, but it's going to cost you. Holding on to urine is one of the things that puts you at risk of getting chronic kidney disease in future. The question is how and why. This is the kidney here. So for some of us, the kidney produces the urine. It passes through this structure here known as the ureter. Okay, and it comes into the storage tank here known as the urinary bladder. What happens? By the time you start feeling that you want to pass urine, this guy right here, the urinary bladder, is almost full or is getting full. What happens? When you hold on to the urine, the kidney doesn't care that this tank here is full. It is still producing the urine. As you hold onto the urine, the tank here becomes overfilled. So the urine being produced in the kidney has no room to come down and be stored in the tank. As a result of that, the urine begins to accumulate in your kidney. This urine that we are talking about is a waste material from your body. It's a toxic material from your body. So as you hold onto it and it is accumulating in your kidney, this waste material are now destroying your kidney, and eventually this puts you at risk of getting chronic kidney disease. If you didn't know, now you know. So for those of us in the morning, you wake up, you feel like passing urine, but you are like, oh, let me sleep small. You are at your workplace, your bladder is full. Instead of going to the washroom, you are like, oh, let me finish this typing. See that you are destroying your kidney. You are poisoning your own kidney with your own toxic waste materials. And we are saying that try and change from that. Very, very important. Next one is lack of sleep. We are now looking at lifestyles that destroys your kidney. Lack of sleep. Lack of sleep. Lack of sleep. See that? Let me show you a diagram so that you can learn from what I'm trying to talk to you about. All right? God bless you so much. Just a minute, guys. I'll be with you. Just a moment. I'll be with you. All right. We can all see this background right here. This diagram is known as the sleep stress anxiety cycle. How does inadequate sleep lead to chronic kidney disease? Some of us are here. Our problem why we are going to end up with CKD is simply because we don't get adequate sleep. Poor sleep puts you at risk of CKD or chronic kidney disease. The question is how and why. When you don't sleep well, okay? When you don't sleep well, what is going to happen is that you are going to wake up the following day when you are stressed up. When you are stressed up, you are going to wake up being anxious. You live a life of anxiety. All right. This anxiety of a thing is going to make your sleep pattern poor again. Now, as you do that, okay, you are going to start producing what is known as stress hormones. You all agree with me that days that you don't sleep well, when you wake up the following day, you realize that you have some form of stress. You go to work, you are not able to deliver the way you expected because the brain is tired and your body is swimming in stress hormones. Now, what happens? These stress hormones that are released as part of the fact that you didn't sleep and now you are stressed up. Example is the cortisol. What cortisol does is that it is now going to, again, let me change the background because I like to be showing things as I discuss it so that you don't have to be stressing your brains, right? Good. We all see this artery here, the small one here known as the renal artery. Because you don't sleep well and you're always stressed up chronically, what is going to happen is that cortisol is going to cause vasoconstriction, meaning that it will narrow this renal artery here. This is going to reduce the amount of blood getting to the kidney. Anything that impairs the amount of blood flowing to your kidney indirectly and directly is going to cause kidney injury. And this is how come people who don't sleep well chronically, you'll be at risk of getting chronic kidney disease. My name is Dr. Mauko Felix. If you are first time meeting me, that is me. I'm a board certified specialist based in Ghana, West Africa. So take note of that. Another lifestyle that puts you at risk of chronic kidney disease that I need you to be aware of. Let me still change the background. Sorry, this is important. It's so important because I don't want to be talking and you're like, where is this guy getting this information from? All right. This is from the Journal of American Society of Nephrology. Okay? The Clinical Journal of American Society of Nephrology. Sodas. Some of us are here listening to us today. Your problem, things that is going to make you get kidney disease in future is the abuse or the use of sodas. Sodas. When I talk about soda, what do I mean? I mean the Fanta, the Coke, the Sprite, the 7-Up, sugary products in general. And for that matter, we are looking at the beverages. Sweetheart, if you are here and you are using your hard-earned money to be drinking Coke, to be drinking 7-Up, Sprite, all those beverages, sugar beverages, this is the largest ever clinical trial that was done by the American Society of Nephrology. And they found out that people who consume these things, again, let me show you the result of that because it's important. I don't want you to say that Dr. Felix is just talking. I need you to be aware that whatever I'm sharing to you, it is something that is actually being documented and it's been written. All right. Unfortunately, part of it is gone. All right. Part of it is gone. Part of it is gone. But let me just try and then see if I could get you a better one. My things are not fitting. Sorry, I'll be with you guys. I think I'll just leave it for now. My thing is going out of shape. What they found in that research is that people who take these sweetened beverages, all right, the Sprite, the 7-Up, all those things, the people who take it, you have 58% higher risk of getting chronic kidney disease. According to the Clinical Journal of American Society of Nephrology, the largest ever research that was ever done. The more you drink Coke, the more you drink 7-Up, the more you drink Sprite, anything sugary, the more you keep doing them, taking them, you have 58% risk of getting chronic kidney disease in future. So take note of that. Very, very important. Another lifestyle that puts us at risk of kidney problem that I want you to be aware of is the use of NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs. Example, brufen, diclofenac, acyclovir, naproxen, all those anti-inflammatory drugs. What they don't tell you is that when you keep abusing them, what they do is that they also destroy the kidney. They destroy the blood vessel. So chronically, those of you, any small thing, you don't go to hospital. You just go to the pharmacy shop. You go and buy diclofenac, acyclovir, naproxen, and all the rest. NSAID abuse, chronic use of them, eventually they destroy your kidney and can make you develop chronic kidney disease. Very, very, very important. Obesity is another one. It's unfortunate. These days, some people think that, oh, when you put on weight, then it's a sign of good living. See that? No. You should be very mindful of your weight. Why? The more you gain weight, the more you grow more abdominal fat. What is going to happen is that this increases your total surface body area. When this happens, your kidney has to stress itself to overwork. So obesity, weight gain, all of them put stress on your kidney and eventually can lead to kidney damage and put you at risk of chronic kidney disease. Another lifestyle, alcohol consumption. I have said this before and I'll say it again. If you are here drinking alcohol, there is no safe amount of alcohol that is good for our body. So if you are drinking alcohol, thinking that, oh, sorry guys, just a minute. If you are drinking alcohol, thinking that, oh, you are living life, you are enjoying your life, sweetheart, no. Alcohol is also one of the things that put us at risk of chronic kidney disease. And for those of you who are still living in the old ages, I want to also project this for your perusal, okay? Alcohol is now a thing of the past. And for the women who take alcohol, the more you take alcohol, the higher your risk of getting chronic kidney disease and also getting breast cancer and all that comes with it. So please take note of that and try and desist out of that. God richly bless you. We are talking about chronic kidney disease and we are now looking at the causes of chronic kidney disease. We are now looking at the lifestyle causes of chronic kidney disease. God richly bless you. Now, another important thing that we want to talk about, I wanted to project something, but I can't really locate it, but let's continue. Another important thing that puts you at risk of chronic kidney disease is common stress. I didn't mention that. Sweetheart, if you are here, try and work on your stress level. If you allow stress to overtake you, you allow stress to overshadow you, this chronic stress level is going to eventually also lead to the production of more stress hormones. The more stress hormone you produce, the higher your kidney injury, and this can eventually put you at risk of getting chronic kidney disease. So please, stress is also another one. Take note of that. Now let me talk about one of the important lifestyle. This discussion will not be complete without it. Not drinking water. I want to ask you today, how much water have you taken? Yes, you. Yes, you listening to us today. You watching us today. How much water have you taken today? One of the common things that destroys our kidney and eventually puts us at risk of getting chronic kidney disease is inadequate water intake. Very important. The higher your blood is concentrated, If your blood becomes very concentrated because you are not drinking water and you are dehydrated in any form, what is going to happen is that the blood getting to the kidney, it's like the Nigerian man will say that you have poured garri in a sieve and you are trying to sieve it. If there is more garri in the sieve will find it difficult. You are trying to sieve it. The water will find it difficult to come out. But now, the same thing happens to our kidney. The kidney receives 25% of the blood that the heart pumps per minute for filtration. What is going to happen? Because you don't like drinking water, the blood getting to the kidney is highly concentrated. The more concentrated the blood is, the kidney has what is known as a filtration membrane known as glomerular filtration apparatus. It's like a sieve. If the blood getting to the kidney is thicker because you are not drinking water, as the kidney is struggling to filter this blood, eventually this destroys the filtration membrane of the kidney. And this is one of the well-established causes or lifestyles that leads to chronic kidney disease. So we beg you, God in his own wisdom knows that water is life. That is why he made it possible that whether you are poor, you are rich, water should be accessible so that everybody can get it. Water, your health, your kidney, your heart, your everything, it depends on that. So those of us who don't like drinking water, I beg you, from today, you know that not drinking water alone can put you at risk of getting chronic kidney disease. Because of our time, let's now talk about what are the signs and symptoms of chronic kidney disease. We've told you some of the causes. We've told you some of the medical and then the lifestyle causes. Now, if somebody is getting a kidney problem, what are the things that put you at risk of that? We've talked about that also. Now, if you have a kidney problem, what are the signs that will tell you that you may be getting a kidney problem and therefore you should get yourself evaluated? God bless you. Number one, we are now talking about the signs of kidney problems or chronic kidney disease. Number one is body swelling. You are here listening to us, okay? You are here watching. From time to time, your eyes, known as periorbital edema, or you wake up early in the morning and part of your face is swollen, especially the part where you put down on the bed like this. It is swollen. This part, it is swollen. Or you get swelling around your eyes, periorbital edema. That is one way chronic kidney disease presents. Or you see that your foot, okay, your foot are swollen. They are not painful, all right? When you press it, it goes inside, but you don't have any pain, all right? That is known as pedal edema, bipedal edema. That is one way kidney problem present. Why is this happening? Remember, I told us at the beginning that one of the main functions of the kidney is to balance the amount of water in our body. Now, when the kidney is getting damaged, it loses that function of trying to regulate the amount of water. Because of that, the water begins to accumulate and seep out of your blood vessels and begin to accumulate in your surrounding tissues, most commonly the peripheral areas. So when you see that your foot are swollen and when you press it, they are not painful, they just sink inside, that could be a sign of a heart problem, but more commonly also you could be having a kidney issue. Next one is blood pressure that is difficult to control. It's also another way chronic kidney disease presents. Difficult to control blood pressure or high elevated blood pressure. Is there anyone on this platform who has CKD, who has chronic kidney disease? They will tell you that their blood pressure is always high, even when they are on medication. The reason is simple. We told you the kidney is one of the areas in the body where blood pressure is regulated. Now, once the kidney is injured and you have a chronic kidney disease, the kidney loses its capacity to control the blood pressure. Because of that, you start having chronically elevated blood pressure. So high blood pressure is also one way chronic kidney disease present. We are not saying that anytime you have blood pressure issue, it means that you have kidney problem. No, but you should remember that blood pressure regulation is done by this guy, and therefore if it is very high, you may be having a kidney problem, and that also needs to be checked. Take note of that. Another sign of chronic kidney disease, chronic anemia, is also one way chronic kidney disease present. There are some people, okay, chronically, they'll be having anemia of unknown origin. Why is this happening? And why could that be a sign of chronic kidney disease? Remember, we told you at the beginning that one of the functions of the kidney is to what? Produce the hormone known as erythropoietin. And the function of erythropoietin is to stimulate your bone marrow to make more red blood cells for you so that it can have a better capacity to transport hemoglobin. Once your kidney is failing, eventually that hormone known as erythropoietin is no longer being produced, and therefore your bone marrow is not being stimulated the way it's supposed to be. So your total red blood cells will begin to go down, and your hemoglobin will also start dropping. So chronic anemia is also one way chronic kidney disease present. And if you keep getting that, please be warned, look out for this guy. It could be the source of the problem. Very, very important. Another important way chronic kidney disease present that we want you to be aware of, sweetheart. If you are here, you wake up in the morning and you see some white patches, as if somebody has sprinkled let me say salt